is get down beneath the thing. So the first tip is make it a story. Make it personal. Make it personal to them. Anecdotes move information. Anecdotes are very important. Personal anecdotes are wonderful. Wonderful. I noticed that with my newspaper column that I've now worked on for a year. As soon as I started bringing my family up, I immediately had people say, you know, I read what you said and it sounded interesting. And you had that problem? I had that problem too. So anecdotes and stories move information. Let me give an example. Okay. Hyperhidrosis. Hyperhidrosis is a problem with youth athletes. It often affects their home and family life. This is a problem that has several solutions, both OTC and prescription. Just awful, isn't it? It's just awful. Who's going to understand that? Okay, now we've got a kid worrying. A little bit more interesting, right? Sweating. You know, but I'm going to keep that same information. A little more interesting. Now I've got something else. I got the sexy guy on the right and the sexy woman on the left. So I'll get a little bit of sex in there. Always good. Sex is good, as sex is okay. If you're in the middle of if you say the word sex in the middle of, somebody says sex and you're in a restaurant in the middle of a conversation, you don't think you're listening to them and you hear sex, immediately comes up. And I mention that because that's very important in terms of information. If you can bring sex in, you'll always get their attention. But anyway, yucky sweating. Another picture, terrible picture. But it's much more interesting than the first one. But this is the story that I actually did. Doc, I sweat too much. Dear Dr. Paster, when I take off my socks, you can smell them clear in the kitchen, and my bedroom is in the basement. This yeasty smell makes my mom sick. I've tried antiperspirant sprays, but nothing touches it. How can I get the girl of my dreams when I have BO? Lonely Jason. It's the same information. It's the same information. I haven't told Jason what to do, but it's much more interesting. And that's what you want to look at when you're moving health information. You want to say, what's interesting to me, not what is technical.